and gentlemen, it gives me great pleasure to be here this morning to address this conference towards a future without cancer on behalf of the Department of Health. I would like to thank the Irish Cancer Society for inviting us to speak, and I'd like to wish all of you very well in your deliberations over the coming 2 days. Today's theme is healthy lifestyles for cancer prevention, and it is in terms of timing is quite apt given the recent launch of Healthy Ireland, the new framework to improve the health and well-being of the Irish people over the coming generation. So what exactly is Healthy Ireland? Well, it's a government framework that sets out a vision, a series of high-level goals, and a framework of actions that, when implemented over the next 12 years, will lead to an improvement in the health and well-being of the population of Ireland. It is a collective response based on international evidence and an extensive national consultation process. And I would like to thank many of you here today who contributed incredible useful input and contributions to its development. And in relation to the consultation process and the outputs, there was a clear consensus that many of the factors influencing society's health and well-being are wide-ranging, and many of them lie outside the health sector. So things like our social class, our working conditions, our education, our environment, our housing, our transport, and our nutrition. Also articulated within the feedback was a belief that while some progress had been made in relation to specific health issues, the approaches to date have only been partially successful. People held the view that we had not yet successfully engaged all sectors to take responsibility. Healthy Ireland will attempt to address this fundamental deficit and provide a leadership role, working to identify ways to strengthen intersectoral action. Healthy Ireland draws on existing policies, but proposes new arrangements to ensure a more effective cooperation to achieve better outcomes. To begin, I want to set out Healthy Ireland's vision. It's one where everyone can enjoy physical and mental health and well-being to their full potential, where well-being is valued and supported at every level of society and is everyone's responsibility. Healthy Ireland contains 4 high-level goals for the achievement of this vision, and these goals are to increase the proportion of people who are healthy at all stages of life, to reduce health inequalities, to protect the public from threats to health and well-being, and to create an environment where every sector of society can play their part. In delivering on these goals, Healthy Ireland sets out a series of 64 whole-of-government and whole-of-society actions that are clustered under the following 6 themes: governance and policy, partnerships and cross-sectoral working, empowering people and communities, health and health reform, research and evidence, and finally monitoring, reporting and evaluation. But before I go into the detail of these actions, I want to spend a few minutes considering why Healthy Ireland was necessary. Well, the good news is that our population is growing, up 8% since 2006. And one of the reasons for this is that people are living longer in Ireland. In the last decade, mortality rates have decreased by 22.5%, and life expectancy has risen. However, not all sectors have benefited equally. And also, not all of these people who are living longer lives are living them in good health. Many people living in Ireland are affected by chronic diseases and disabilities related to poor diet, alcohol misuse, smoking, and physical inactivity. Enjoyment of health is not evenly distributed, with prevalence of chronic conditions and accompanying lifestyle behaviours being strongly influenced by the socioeconomic status, the levels of education, employment and housing. It's worth reflecting at this point on some of the stark statistics that highlight the challenge we face in creating a healthier Ireland, and that will consume much of your deliberations over the next few days. So take the issue of obesity. 2 out of 3 adults are overweight or obese. 25% of pregnant women are overweight or obese. almost 1 in 10 3-year-olds in lower socioeconomic groups are obese, compared to 1 in 20 in higher socioeconomic groups. And 20% of all children are overweight. In relation to alcohol, Ireland's rate of alcohol consumption is one of the highest in Europe, at almost 12 litres per head of population. Alcohol is responsible for approximately 90 deaths per month and is a factor in about half of all suicides. And despite the considerable progress made in tobacco policy, smoking is still a challenge that needs to be overcome, with some 5,500 tobacco-related deaths occurring each year. Around 1 million people smoke in Ireland. 12% of children aged between 11 and 17 are current smokers. And smoking rates are highest among women aged 18 to 29 from poor communities, almost double the numbers in higher socio-economic classes. Lifestyle-related chronic diseases now account for over 70% of all deaths in Ireland, and the major modifiable risk factors for chronic diseases are shared with cancer. 30% of all cancers are caused by poor diet and obesity, and approximately 4% of those are alcohol-related. A further 33% are caused by tobacco. Such outcomes have devastating consequences for people at an individual level, but they're also worrying for the country as a whole in terms of economic loss and rising healthcare costs. Unless preventative action is taken, the number of people with chronic conditions and cancer is set to rise dramatically by 2020, creating further pressures on an already overstretched health system. Approximately 28,000 cases of cancer are diagnosed each year. That's approximately 50% more than in the mid-1990s. The number of newly diagnosed cancer cases is increasing by 6 to 7% annually, and unless a major reversal of trends occurs in the near future, the number is likely to double in the next 20 years. The rise in cancer cases in Ireland is the biggest predicted rise in EU member states. So I think you'll agree, in light of these data, there was no option but to develop a structured, integrated response, and hence the publication of Healthy Ireland. Now I will present the framework of actions, the 64 whole of government, whole of society actions. Government, governance and policy, partnerships across sectoral work, empowering people and communities, health and health reform, research and evidence, monitoring, reporting and evaluation. And these themes embody the characteristics of a successful approach to improving population health in international literature and resonate strongly with WHO's Health 2020. It would clearly be impossible to present all 64 actions today, so what I intend to do is highlight some that will hopefully give you a sense of the breadth and the scope of it, and also the approach that we've adopted. So under the theme 1, governance and policy, well, government at the highest level will be taking an interest in our progress. In this context, the Cabinet Committee on Social Policy, chaired by Taoiseach, will oversee the delivery of Healthy Ireland, with the Health and Wellbeing Programme in the Department of Health taking responsibility to drive it and for the planning and coordination. A multi-stakeholder Healthy Ireland Council will support the implementation process through developing a network of advocates throughout the country who will actively contribute to the debate on health and wellbeing. A further action that I would like to highlight is the development of a new integrated social impact assessment tool. And this tool has been agreed by government as the new tool to support poverty proofing to meet government's target in this area. We now have agreement that this tool will also include health impacts, and the Health and Wellbeing Programme, together with the Social Inclusion Unit in the Department of Social Protection, will both develop the tool and build capacity to use and implement it, so it can contribute to a culture of health in all policies. Theme 2, partnerships and cross-sectoral work. Well, the actions under this theme focus on supporting implementation through existing structures such as local authorities, children's services committees, the community and the voluntary sector, and also the private sector. Healthy Ireland acknowledges the role that local authorities already play in protecting and promoting health and wellbeing, particularly so, I think, in areas of disadvantage. And Healthy Ireland contains several actions that will seek to strengthen these local structures. Theme 3, empowering people and communities. Well, if our lifestyles are to become healthier, then they will involve each of us, each member of society, taking action and responsibility to bring it about. However, we in government need to look at how we empower people and communities through the choice architecture so that the healthy choice becomes the easier choice. And if we consider something like our Dublin bike scheme, it's a very good example of this. It's one of the most successful in the world. Since its introduction less than 4 years ago, over 5 million journeys have been taken. Dublin Bike's success is demonstrated by the fact that the number of bikes is set to treble in the next period. Most importantly, it has succeeded in helping to significantly increase the number of people cycling in our capital. Another key aspect of the work under this theme of empowering people and communities will be to engage with those people experiencing inequalities in our society and supporting ways that reach and mobilise the key leaders within these communities. Theme 4, health and health reform. Well, we know that the capacity and efficiency of our health systems affect our health and well-being. Significantly, health and well-being is a distinct pillar in future health, a strategic framework for reform of the health service. And one of the key areas of work under Healthy Ireland will be ensuring that our goals are integrated into cross-directorate and cross-functional working arrangements as part of that reform package. This work will also seek to translate down to a local level, where, for example, we'll be looking at how best to leverage the expertise of people like public health nurses to devise programmes that will improve the health of the communities that they work in. Theme 5, research and evidence. We need to ensure that the actions taken under the framework, including our funding strategies, our communications programmes and our work practices, are premised on robust evidence about the determinants of health and best practice approaches in addressing them. A Healthy Ireland research plan will be developed to build a knowledge base and to make sure that the most up-to-date data are available to decision makers. And Theme 6, monitoring, reporting and evaluation. There are many information systems and tools in place to monitor health and well-being as well as lifestyle-related risks. Ongoing and new data collection methods need to be identified to fill gaps, and sufficient controls and quality assessments need to be in place. Key to this theme is an outcomes framework which will include targets for quantifiable improvements in different areas. This outcomes framework will be agreed across government departments, statutory bodies, delivery partners, and will be subject to rigorous monitoring and evaluation. So now that there's a consensus on what needs to be done, how do we propose to implement it and when? Well, our immediate priority is to focus on the delivery of a number of pivotal actions that will lay the foundations for the implementation. And these building blocks include a high-level implementation plan with clear governance arrangements, a research plan, an outcomes framework, a physical activity plan, an outline implementation for the positive ageing strategy which has recently been launched, a communications plan around the use of the Healthy Ireland brand so that it becomes an easily recognised identifier for all of our collective efforts, and the Healthy Ireland Council. And how are we going to do this? Well, Healthy Ireland, as you will have realised, is extensive and complex. We are devising mechanisms to provide robust governance to the process and capacity for collaboration for the implementation phase at a number of levels, including a high-level cross-departmental steering group to strengthen engagement across the various government departments and also to provide strategic direction for overall implementation strategy. Within the Department of Health, a cross-divisional group has been established to coordinate activity and to ensure that health and well-being is embedded into the new reforms. Working groups are being set up to address particular actions or suites of actions. Through the health reform programme and the new directorate structure in the HSE, we will be agreeing mechanisms, timelines and priorities to deliver on the health and health reform actions outlined in Healthy Ireland. Through the Council, we will be identifying key individuals who have a footprint throughout the country who can realise our ambition to create a really, really strong advocate network. We are continuing to build capacity within the Health and Wellbeing programme to ensure that it has the skills to coordinate this work, manage it, report on it, and generally support its implementation. Earlier, I referred to the theme, which was partnership and cross-sectoral working. But I want to end my remarks to you by returning to this, because it is clearly more than simply a theme. It's fundamental to the success of Healthy Ireland. Those of us involved in developing and implementing Healthy Ireland understand that the goals of Healthy Ireland will only be achieved by us all working together, led by government involving policymakers, civil society, leaders and wider groups. All need to be actively engaged in the process. Cross-sectoral working is not new, but it does take effort. We have already proven that when we are determined and resolute on important issues, we have reaped the benefits of such collaborative and cross-sectoral working. For example, the Road Safety Authority's strategy, which has successfully almost halved the number of deaths and injuries on our roads since 2000, has involved a range of active partners: the Garda Síochána, local councils, government departments and schools. The Green Schools programme aimed, among other things, at encouraging pupils and parents to walk or cycle to school, involved parents, schools, An Taisce, the Department of Transport and the Road Transport Authority, has in a very short space of time reduced by over 1/4 the reliance on private cars for travel to school. And then closer to home in the health arena, and John mentioned this earlier, the introduction of the smoke-free workplaces in 2004, in which the Irish Cancer Society played a key role, was based on a successful partnership between health organisations, political leadership, the Department of Health, trade unions and wider civil society. This revolutionary move, as it was at the time, has set the template for similar moves across the globe. What all of these initiatives demonstrate is that real change can be brought about. What we are trying to bring about through Healthy Ireland is a change in the hearts and minds of the Irish people, which will lead to a change in their lifestyles. We don't have all the answers, and we need and would value your involvement. This is just the beginning of a process. The endeavour is in its infancy, and I'm asking you here today for your help, to work with us as we set out on this challenging but what we consider a significant journey to improved health and wellbeing. Thank you for your attention, and I hope the next 2 days are both positive and productive.